Good afternoon, everyone, and welcome to today's wonderful afternoon with Dr. Murali Bharadwaz. How to do the revision? How to do the revision, especially of those topics like pharmacology, preventive medicine, which are very dry to remember. There is a new way we started. It's called mantras, audio mantras. To know all the logic, reasoning, everything is great. But in the last moment, are you able to revise quickly? What is the answer for this question? This question, what is the answer? That is most important. So how can we make the students revise effectively to not worry at all for the tomorrow's exam? Even though the date is coming closer, you should feel confident every day. So that is where Dr. Murali Bharadwaz is along with you. Shortly, we are adding a new feature called 100,000 audio mantras in the Score Learning app. So today only download the Score Learning app and subscribe. It just costs you 1,000 rupees a month, the cheapest preparation ever possible on the planet Earth. So let's make the great beginning of Q&A format of a rapid revision. Nice to see Vinisha, Yash Sharma, and many more who are all online, doctor. Now, what's the mechanism of action of NRTIs? NRTIs inhibit the HIV reverse transcriptase so that they inhibit the DNA synthesis. How will NRTIs lead to a defective viral particle? Basically, NRTIs compete with the nucleoside triphosphates from getting added into the newly synthesized viral DNA. That lead to a defective viral particle. What are the class-specific adverse effects of NRTIs? Neutropenia, megaloblastic anemia, especially zidovudine, is notorious to lead to development of bone marrow suppression. Pancreatitis, diadenosine, peripheral neuropathy, hypersensitivity, lactic acidosis, especially with abacavir. They're all the important side effects. Specifically, you need to remember. If you look at the most recent NEET PG 2023 exam, so many questions on HIV. So you have to be 100% sure, doctor. What is the role of zidovudine in preventing HIV from mother to child? It is very effective. It significantly reduces the risk of viral transmission from the mother to the child, is what you need to remember. Nucleotide analog reverse transcriptase inhibitors, tenofovir, edifovir, they're the ones which are called NRTIs. What are the indication for lamivudine in addition to HIV infection, doctor? You remember the answer. Chronic hepatitis B is what should be remembered. Neutropenia is an important side effect of which heart therapy, doctor? All NRTIs, their class-specific side effect is bone marrow suppression, is what you need to remember. Bone marrow suppression. So, zidovudine specifically lead to megaloblastic anemia, which NRTI lead to pancreatitis, doctor. Diadenosine is the one which lead to pancreatitis. Which NRTIs lead to peripheral neuropathy? Zolcitabine and stavudine. You need to remember for peripheral neuropathy. Abacavir, lactic acidosis, abacavir. Last moment before exam, you need to remember it like that. What is an indication for NRTIs? Tenofovir and edifovir, not only in HIV but also hepatitis B infection we give edifovir, is what you need to remember. What is the action of NRTIs in the treatment? Then also reverse transcriptase inhibitors, and they block the DNA synthesis. What are the common NRTIs? Reflexly, you should answer nevirapine. You should remember Steven Johnson. Efavirenz for suicidal dreams. You get suicidal tendency, vivid dreams, efavirenz. And delaverdin. These are called NNRTIs. What are the main side effect of nevirapine, Dr. Steven Johnson? Fulminant hepatitis, cytochrome P450 induction, classical of the Steven Johnson's is, these are all the features of the nevirapine is what you need to remember. What drugs are metabolized faster whenever you give nevirapine? Nevirapine is a P450 inducer. That's the reason oral contraceptives, warfarin, metronidazole, ketoconazole, and some protease inhibitors, they're all metabolized faster because of the P450 induction caused by the nevirapine is an important drug reaction. Efavirenz, insomnia, giddiness, vivid dreams, nightmares, suicidal depression, classical of efavirenz. What is the main teratogenic risk of delaverdin, Doctor? Delaverdin is teratogenic. Please don't forget. You can never use it in a pregnant woman who is HIV positive. For pregnant women, zidovudin is very safe. What is the common side effect of delaverdin? Elevated LFTs. What is the main indication for NNRTIs whenever you are using in HIV? NNRTIs are mainly for HIV, unlike the other antiretrovirals. Some of them can be used even for HBV, HCV, etc., etc. So what is the mechanism of action of nevirapine? It is an NNRTI. NNRTI is what you need to remember. Easy. N is nevirapine. So NNRTI is nevirapine. What is the main side effect of nevirapine, Doctor? As we said, Steven Johnson is the most important side effect. Nevirapine-induced hepatotoxicity, whenever it is there, no, you need to stop nevirapine and switch to an alternative antiretroviral. That's the reason whenever you are giving nevirapine, you need to serially follow the LFTs in order to monitor and look forward for the liver dysfunction. Efavirenz-induced CNS disturbance is mainly vivid dreams. That's the reason you need to give supportive care. They have a tendency for suicidal tendency will be there with efavirenz. So the teratogenic risk of delaverdin is very high. That's the reason it is not recommended for use in pregnant women. What is the mechanism of action of protease inhibitors? Protease inhibitors ultimately go and inhibit the protease so that it prevents the organization of the whenever the virion forms, all the proteins need to combine together for it to be released into this world. So protease inhibitor is responsible for cleaving the precursor proteins into the mature proteins, and that is inhibited means mature proteins are not formed and viral particle cannot be reconstituted is what you need to remember. Nice to see Vinisha and everybody. Can you please punch? Is the voice loud and clear for all of you, Doctor? Because I'm broadcasting from the home. A lot of students gave a feedback that early morning, afternoon is a wonderful time that we can interact. What are the common protease inhibitors which are used in the treatment of HIV? So we should remember sakinavir, ritonavir, rindanavir, nelfinavir, lopinavir, estanavir, fosamprinavir, tipranavir, darunavir, and amprinavir are the protease inhibitors. What are the common side effects common to all the protease inhibitors, Doctor? Altered distribution of the body fat. In the nape of the neck, patient gets fat deposited. insulin resistance, hyperlipidemia, GI discomfort, paresthesia, elevated bilirubin, kidney stones, renal stones. Please don't forget about protease inhibitors. What is the drug interaction with ritonavir? Ritonavir inhibits, remember, if you look at the drugs which are NRTIs, we found that they are inducers. But ritonavir is one of the favorite question. Inhibitor is what you need to basically remember. What is the role of ritonavir in combination therapy of HIV? Typically, you want to maximize the half-life of other antiretroviral drugs because ritonavir, remember, ritonavir retards the metabolism of all other drugs. That's the reason if you want to increase the half-life of all other drugs, nice to see Meghasvana and many more who are all online, loud and clear, very good. So, if I keep on giving you paragraphs and you need to revise means very boring, doctor. But if I challenge you with a question, you are able to recall, reproduce that answer, that day, your revision will be very fast. That's the reason I redevised a new strategy, which is the whole study material, 1200 pages notes I gave you. Now we are converting that into a question answer format. So it becomes easy for you. Answer will be an audio, question will be a text before you. Fatafat, you can do the revision. This is the new feature we are adding into your favorite score learning app. You all need to give me a feedback whether that really helped you, right? Because revision is all about like a reflex mechanism at the spinal cord level, at cauda equina. You should be able to answer, right, doc? So, what are common side effects of indinavir? Indinavir lead to kidney stones. India is famous for kidney stones, no? Lot of urologists have. Summer aa gaya to India mein urologists have a lot of business. Full kidney stones, right? So indinavir, kidney stones. Indinavir, elevated bilirubin. For the management, if the patient has hyperlipidemia, doctor, whenever hyperlipidemia is there, then you need to use lipid lowering drugs, lifestyle modification, etc. need to be done. What are the most common side effect of ritonavir? Ritonavir, GI discomfort. Protease inhibitors in inhibition of HIV replication. So as we said earlier, protease cleaves the precursor proteins into mature proteins. That is being prevented. For indinavir-induced kidney stones, what is the recommended management, doctor? Increase fluid intake, and sometimes you need to discontinue the drug if the stones are developing. It does not mean it happens in every patient, but whenever it is there, you need to be watchful. Mother-to-child transmission of HIV. Protease inhibitor are the cornerstone to mother-to-child transmission. MTCT of HIV is what you have to remember. What is the action of integrase inhibitors in the treatment of HIV infection? Integrase inhibitors reversibly inhibit the HIV integrates, which incorporates the viral DNA into the host DNA. That is the function of integrase. What are the common integrase inhibitors, doctor? Raltegravir, elvitegravir, dolutegravir, raltegravir, elvitegravir, dolutegravir. They are the common integrase inhibitors. What are the clinical use of integrase inhibitors? Mainly in HIV primarily. What are the main side effect of all integrase inhibitors? Rash, diarrhea, insomnia. Insomnia just like efavirenz. Entry inhibitors. They prevent the entry of the viral genome. So what are the main risk with maraviroc? Maraviroc and hepatotoxicity need to be remembered. So whenever there is a rash with integrase, what do you want to do? Symptomatic relief and consider alternative antiretroviral. So what is the main mechanism of enfuvirtide in the treatment of HIV? Enfuvirtide inhibits the membrane fusion by blocking GP41 protein. Which protein? GP41 HIV protein is what you need to remember. So what is the significance of CCR5 in the treatment of HIV? CCR5 is a co-receptor for HIV, and it is the target for the maraviroc in the treatment of HIV. So what is the main management of maraviroc-induced hepatotoxicity, doctor? Discontinue the drug and monitor the liver function. So what is the main mechanism of elvitagravir in the treatment of HIV? Elvitagravir inhibits HIV integrase, prevents the incorporation of the viral DNA into host cell genome. So what is the role of integrase inhibitors in the antiretroviral-resistant HIV? Very important. So whenever highly active antiretroviral therapy resistance is there, integrase inhibitors, very helpful. This is a favorite MCQ in the tomorrow's exam. What is the mechanism of action of acyclovir? Acyclovir is phosphorylated by viral thymidine kinase into an analog deoxy-GTP, which acts to inhibit the DNA synthesis by incorporating into the viral DNA strand and lead to chain termination. So what are the drugs similar to acyclovir, valacyclovir, pencyclovir, and femicyclovir? What are the main clinical use of acyclovir, doctor? Genital herpes, herpes meningitis, encephalitis, varicella zoster, oral hairy leukoplakia, which is due to Epstein-Barr virus infection, is what you need to remember. What is the main side effect of acyclovir, doctor? Nephrotoxicity, neurotoxicity, nephrotoxicity, neurotoxicity is what you need to remember. Why is acyclovir inactive on latent herpes virus infection? Because acyclovir targets DNA replication. If it is a latent virus, no replication, no acyclovir can work. What is the recommended treatment of acyclovir-induced nephrotoxicity, doctor? Whenever the creatinine elevates, discontinue the drug and provide supportive care of the renal function. What is the correct dosing of acyclovir, doctor, for genital herpes? 400 mg, 3 times daily, big tablets. Alarm laga ke lena padta hai. For 7 to 10 days is what you need to remember. If at all there is any acyclovir resistance, how do you want to manage? Foscarnet, please don't forget. Foscarnet and cidofovir. So fundamentally, when acyclovir comes now, acyclovir need to become acyclovir phosphate, for which you require a kinase. That kinase is provided by actually the virus. So virus also become intelligent. Why should I phosphorylate acyclovir, make it active and kill me only? So that kinase will say, no, I will not convert acyclovir into acyclovir phosphate. Jao, it will tell. Whereas foscarnet or cidofovir don't need such a phosphorylation to happen for them to start working. That's the reason, even if acyclovir resistance is there, we still use foscarnet and cidofovir is what you need to remember. What is the mechanism of action of valganciclovir? Valganciclovir is the prodrug of acyclovir, rapidly converted into acyclovir. So what is the dose of acyclovir for herpes zoster, doctor? 800 mg. Oh my God, very big tablet. 5 times for 7 to 10 days for herpes zoster. Viral thymidine kinase, what is the importance of it? Viral thymidine kinase is required for converting acyclovir into its active form. So that is the reason any acyclovir resistance is because of the resistance of the viral thymidine kinase is what you need to remember. Foscarnet or cidofovir, they are not dependent on that. That's the reason they can be given even if acyclovir resistance is there. What is the mechanism of famciclovir? Famciclovir is also prodrug converted to penciclovir, which acts similar to acyclovir by inhibiting viral DNA synthesis. What is the mechanism of action of ganciclovir to treat CMV? Ganciclovir is the analog of guanosine. After phosphorylation by the viral kinase, it becomes a nucleotide analog. It acts preferentially to inhibit CMV. CMV, ganciclovir. CMV, ganciclovir. That is what you need to remember. So what are the drugs similar to ganciclovir? Valganciclovir can become ganciclovir. What are the clinical uses of ganciclovir? Ganciclovir specially is used for CMV retinitis in AIDS patient. What will you use? Tomorrow examiner is going to ask this question. What is your answer? Ganciclovir. So what are the main side effects of ganciclovir, doc? Pancytopenia, nephrotoxicity, seizures is what you need to remember. What is the main mechanism of action of foscarnet? Foscarnet is a pyrophosphate analog. Already it comes like a phosphate. It don't need any further phosphorylation. And it will inhibit the viral DNA polymerase without requiring the activation by viral kinase. So what is the recommended treatment? If nephrotoxicity develops with foscarnet, stop the drug and provide supportive care. So a lot of these antiviral drugs, which drugs carry nephrotoxicity, which drugs carry hepatotoxicity, you have to be sure which drugs lead to bone marrow suppression. Be very, very clear, doctor. So what is the dosing for CMV retinitis? Ganciclovir 5 mg per kg intravenously twice daily for 14 to 21 days, followed by maintenance dose of 5 mg per kg. Valganciclovir-induced neutropenia, if it is there, what will you do? Hold the drug and monitor the blood count. What is the mechanism for cidofovir in the treatment of viral infection? Cidofovir is a phosphate nucleotide analog of cytosine. Cytosine, cidofovir. Cytosine, cidofovir. And it inhibits the viral DNA polymerase. What is the importance of ganciclovir's preferential inhibition of CMV? Typically, it goes and selectively targets the CMV so that the human cells won't be affected. Long-term ganciclovir treatment, whenever you are giving for CMV retinitis, what you need to do? Monitor the blood count, monitor the renal function. What is the appropriate dose of foscarnet if you are treating acyclovir-resistant HSV? 40 to 60 mg per kg every 8 to 12 hours for 7 to 14 days. So what is the main mechanism of tenofovir in the treatment of HIV and hepatitis B? Tenofovir is a nucleotide reverse transcriptase inhibitor. It inhibits the viral reverse transcriptase. What is the main use of it? Not only HIV, tenofovir is also for hepatitis B, is what you need to remember. So totally, doctor, there are 135 points that you need to remember when it comes to viral drugs. It takes not even 1 hour, 50 minutes is enough. I'll make you champion. Next time before exam, when you do revision, you should not take more than 10 minutes. Today only all these points are there in the 1200 pages notes I gave you, doctor. Today only please order for the notes. We will courier to your home and you can do happily revision. So common side effect of tenofovir is renal toxicity, bone mineral density loss is what you need to remember. If you want to monitor the patient on long-term tenofovir therapy for HIV or hepatitis B, what do you want to monitor? Kidney function tests and bone density, doctor. Bone density tenofovir. Tomorrow exam, it should come like a parrot in the tomorrow's exam. What is the main mechanism of enfuvirtide in the treatment? Enfuvirtide is the entry inhibitor. Remember, GP41, GP41. If you don't remember GP41 in exam hall, dikkat ho jayega, right? So, it's not knowing lot of information, doctor. It is knowing precisely, focused way, reflexly, like a parrot. You should answer in the tomorrow's exam. Darunavir in the treatment of HIV. You get 800 mg per once daily with 100 mg of ritonavir once daily. Darunavir 800, ritonavir 100. Isko bolte Danavir R. Very common brand. What is the recommended management for tenofovir-induced renal toxicity? You need to discontinue the drug and provide supportive care, right? So, enfuvirtide in treatment. So, we give 90 mg. It comes as a very popular brand called Fujion, 90 milligrams. Subcutaneously it is given. That is another important point. Enfuvirtide is given, subcutaneous injection is what you have to remember. So what is the main mechanism of lamivudine in the treatment of chronic hepatitis B? It is a nucleoside analog reverse transcriptase inhibitor that inhibits the viral reverse transcriptase. Chronic hepatitis B में lamivudine का role क्या है? It is used even for chronic hepatitis B infection. It will improve the liver function and reduce the viral load is what you need to remember. Long-term enfuvirtide therapy, if you are giving, you should look for any injection site reaction and also look for the viral load, CD4 count to monitor. Darunavir can lead to the development of rash, which may require to discontinue the drug. Now, oseltamivir, zanamivir, you need to be very sure. Oseltamivir is the prodrug. It will go inside, intracellularly it get activated and then it will go and inhibit the neuraminidase inhibitor is what you need to remember. So what is the role of neuraminidase, doctor? It cleaves the sialic acid moiety. Sialic acid moiety on the glycosylated hemagglutinin, which will allow the budding of the viral particles to be released from the host cell. What is the clinical use of oseltamivir? It is used for prophylaxis and even treatment of influenza A and B. So how do you use oseltamivir? Typically, there are certain groups like very elderly people, patients with COPD, immunosuppressed people, young children. If at all influenza come, they develop horrible complication. For them, oseltamivir is recommended. What is the main side effect of oseltamivir? Headache, vomiting. 65-year-old, COPD, flu-like symptoms. What do you want to give? Oseltamivir. What is the mechanism of oseltamivir? As we said, it is the one which is inhibiting neuraminidase. For prophylaxis, what can you give? Oseltamivir can very much be given. What is the side effect of oseltamivir? As we said, headache and vomiting. If he is allergic to oseltamivir, then what do you want to give? Zanamivir. Then what is the main mechanism of action of amantadine? Amantadine binds to the M2 surface protein of the influenza A viral particle so that it will block the uncoating of the viral RNA, inhibiting the viral replication. Virus will enter, but first it needs to become naked, leaving its shirt, pant, everything. No, it won't let it happen. Amantadine is known to also stimulate the release of dopamine. So what are the clinical uses of amantadine, doctor? It is used for influenza, and also it is used in Parkinsonism. So what is the side effect of amantadine? Typically ataxia, slurred speech, giddiness, GI upset, etc. What is the mechanism of rimantadine? Similar to amantadine, it blocks M2 channel of the influenza A, inhibiting the viral replication. Both amantadine, rimantadine, M2 ion channel protein of the influenza A virus particles, you should remember. Elderly patient is at risk of getting influenza. You can give elderly people, especially tomorrow clinical unit will be given elderly patient. Amantadine very much can be given. Patient with Parkinsonism with influenza, amantadine is the one which is preferred. Now, what is the side effect of amantadine? Mainly GI upset. If a patient is allergic to amantadine, as we said, rimantadine can very much be given. So what is the mechanism of ribavirin? Is a very important question. Ribavirin is a guanosine analog. Ribavirin is a guanosine analog. Not adenine, not thymine, guanosine analog. It inhibits guanine nucleotide synthesis and inhibits the viral RNA polymerase, not DNA. RNA polymerase is what you need to remember. So where do you use ribavirin? Ribavirin is used for respiratory syncytial virus bronchiolitis, influenza A and influenza B. And don't forget, hepatitis C. Hepatitis C. Hepatitis C is very dangerous. Hepatitis B at least has got a vaccine and many drugs. But hepatitis C, very few. So ribavirin. So what are the side effects of ribavirin? Hemolytic anemia, elevated bilirubin. It is also teratogenic, but remember, hemolytic anemia and ribavirin. Last moment in the exam hall, impossible to remember this kind of nasty questions. So what is the mechanism of entecavir? Entecavir is guanosine nucleoside analog, preferentially inhibits hepatitis B. Hepatitis B polymerase and inhibits viral replication. How is ribavirin and entecavir are similar, doctor? Both of them are antiviral and they inhibit viral polymerase and prevent viral replication. Chronic hepatitis C is being treated. Which medication we use to treat him? So don't forget, ribavirin, hepatitis C. Hepatitis C. So, pregnant patient with bronchiolitis of respiratory syncytial virus, which medication should not be used? Ribavirin is contraindicated in pregnancy. So, what is the main side effect of ribavirin? Hemolytic anemia, elevated bilirubin teratogenicity. Hepatitis B में what can you use? Entecavir, because it inhibits viral polymerase and prevent viral replication. So sofosbuvir, this is declaxvir and sofosbuvir tablet, 60/400. Sofosbuvir is a HCV RNA-dependent RNA polymerase inhibitor. RNA-dependent RNA polymerase inhibitor that lead to chain termination and inhibition of viral replication. So examiner specifically will ask sofosbuvir. Sometimes first time you will be looking at this in the exam hall. That should not happen after attending Dr. Murali Bharadwaz, right? So what is sofosbuvir used to treat? So doctor, please share this video to all your friends. Please also give some likes. I'm going to launch a lot of audio mantra videos. Audio mantra condensed into a video, 1-minute videos, and upload into the YouTube for spicing up your preparation, doctor. That is most important. Sofosbuvir is used to treat HCV of the genotypes 1, 2, 3, and even 4 also. What is the usual combination therapy of sofosbuvir? Sofosbuvir plus ribavirin. Sofosbuvir with pegylated interferon. Peg means not whiskey peg. Peg is polyethylene glycol. Polyethylene glycated. So that shelf life of the interferon will increase. So pegylated interferon, ribavirin, sofosbuvir are all combined. So what are the main side effect of sofosbuvir, doctor? Fatigue, headache, insomnia. Simipravir is hepatitis NS3-4A protease inhibitor. NS3-4A. This looks like home address. Hepatitis C ka NS3-4A protease inhibitor that prevents viral replication. What is the usual combination? Simipravir, sofosbuvir, simipravir, ribavirin, simipravir, pegylated interferon. Anything can be combined. So what is the side effect of simipravir? Photosensitivity. Okay? Headache and fatigue. Ledipasvir. This is ledipasvir with sofosbuvir. Once more for hepatitis C. Tomorrow you are all going to become top gastroenterologists with hepatology. This is day in and day out thing. NS5 protein inhibitor blocking viral replication. Simipravir with ledipasvir. What is the combination therapy? Simipravir can also be used along with ledipasvir. So headache and fatigue are the main side effects. 45-year-old with genotype 2. Hepatitis C virus genotype. Always when HCV is detected, you need to find out which genotypes are there. So what is the recommended treatment? The recommended treatment for chronic HCV infection of genotype 2 is sofosbuvir with ribavirin for 12 weeks. 35-year-old chronic HCV genotype 1A comes to clinic. What is the treatment recommended, doctor? For 1A, sofosbuvir and simipravir combination is used. Genotype 3 presents to the clinic. What is the recommended treatment? Sofosbuvir and ribavirin combination for 24 weeks. So what are the main side effects when you combine the two? Common side effects: fatigue, headache, and nausea. 60-year-old with genotype 4 comes to you. Sofosbuvir with ribavirin for 24 weeks. That is the combination. So lepidosvir inhibits CNS5 protein. So this is very important. Batti ratta marne wala item hai, doctor. NS5B inhibitors, NP1 is sofosbuvir, NNPI is dasabuvir. Then what is NS5A inhibitors? Ledisavir is NS5A inhibitor. What is NS3-4A inhibitor? It is cimipravir is a NS3-4A inhibitors is what you need to remember. So these are all what typically virus hepatitis C has structural protein, polyproteins. Once they are being cleaved, you get a different combinations. That's what you need to remember. Genotype 1B, ledipasvir and sofosbuvir combination therapy for 12 weeks. Genotype 3, sofosbuvir and ribavirin combination therapy, especially if they have a depression and anxiety. So these are some of the important things, doctor, for the tomorrow's exam. Mainly, you need to know pelapravir, cimipravir are fundamentally NS3, N5A. NS5A, ledipasvir. NS5E is sofosbuvir, is what you have to ultimately remember. So preparation for exam is a fun. Nothing to do with brain. First, respect your brain, respect your memory, respect yourself, because you are once upon a time with tough competition. 1.5 million people were competing, and you are in that 1,100,000. Now from that 100,000, you need to move into the top 5,000. How is that possible? Studying with Dr. Murali Bharadwaz every day. See you all once more in the evening. Q&A format. Did you like this? Instead of a didactic paragraph-wise revision, you don't get focus. But it is like a Q. Your mind is actively thinking, what is the answer? Then you get the answer as an audio mantra. Then you will remember it. Thank you all. Enjoy a wonderful afternoon. Beautiful weather in Hyderabad. Thank you.